She talks to us like we're not people who have experience in the workforce. She didn't own up to that she was confusing us. What in the world is going on? My current clinical supervisor, she's just not that great. She's younger, I think, than all of us. Maybe not all of us. There's some pretty young people that just got out of their first degree that are going into the second degree program. But she's younger than most of us. She's the first clinical supervisor we've had that insisted we call her Mrs. last name. And yes, it's Mrs. because she doesn't have her doctorate or anything. She has her master's degree. She's experienced. I'm sure she's qualified experience-wise to be our clinical supervisor. I have no doubt about that. But she just doesn't seem like she has a lot of respect for us. And yet she wants a lot of respect from us. Our group's caught her in like a couple mistakes, even like when she's trying to tell us things, which I just made another video. Everyone makes mistakes. The difference is she does not own up to them. She made a mistake giving us examples of ABG values. What is that what it's called? ABG? Arterial blood gas, ABG. She made a mistake. She was giving us examples of ABG values and helping us like figure out respiratory acidosis, respiratory alkalosis, all that. She's like,
here, let me give you an example.
And she gave an example of numbers that just really didn't make sense. So the patient's blood gas in this example was normal and it wasn't acidotic or alkalosis. And then the patient's, I think it's PCO2, it's whatever one aligns with the respiratory problems, was on the, I think, the base side. And then the patient's HCO3, I don't know if that's the right number, but it's whatever aligns to if it's your metabolic versus respiratory. It was also on the base side. So like their pH should have been base. It was the numbers that I don't think, not that it couldn't exist, but is never going to come up on the NCLEX. And I feel like if a doctor saw that, they'd be like,
what in the world is going on?
Once she realized, I'm pretty sure she realized,
oh wait, this is a really bad example. It doesn't really fit with any of them.
She just actually shut things down. It was like,
okay, you know what? Let's just go over some examples on this paper.
And she pulled up a paper. She didn't own up to that she was confusing us. She just switched really quick. Like, own up to your mistake. Just like,
oh, I messed it up. This is a bad example. Here.
No, she just kind of mumbled something and then switched. She messaged, as far as we know, our preceptors, because one preceptor said,
hey, your clinical supervisor messaged me just asking for our weaknesses.
That's just, I don't know, that just kind of rubs you wrong. Like you're just asking the preceptors what we're doing wrong and not our strengths. The other day in clinicals, this seems a little more normal if it wasn't for us knowing that she asked preceptors what we were doing wrong and only what we were doing wrong. But the other day in our clinical supervision, she's like,
I want all of you to think about something you can improve on and let's go around and share what you need to do better.
And she just has a kind of a negative attitude about things, and she talks to us like we're not people who have experience in the workforce. And many people in my program have, we all have at least one degree in something. Most of us have experience working several years in different fields. Some people in our group have master's degrees, and we're talked to like we're little kids. She dinged people for not having APA style on their papers when it actually was an issue with Blackboard. Blackboard, when you upload your papers, changes your formatting a little bit. And someone, she can't know that. She's new to, working with Elmhurst. She's new to Blackboard maybe. But when someone messaged her and said, hey, that problem you see that you think is not APA style, that's an issue with Blackboard. It changes our formatting a little bit. Here's my Google Docs. You can look at it. She actually responded to that person and said,
well, are you sure you didn't upload that to Blackboard before you made those changes?
Like she questioned that they were like trying to trick her, which again, just kind of treat us like adults. And this is about APA style. This is not even about something that's going to be relevant to most of your nursing career. Yesterday, knowing that she was dinging people on this APA style thing, she made a point to tell us,
I was looking through your papers. Now, like, make sure your title is not bolded on the title page. That's not APA style.
And I was thinking,
Yeah, it is.
and then she's like,
And you shouldn't have a number on your title page. The page number should start on your second page.
and I'm thinking,
That's not what I did.
and just, she told us all in her little bio that she went to Purdue. We've been told to use the Purdue website for APA guidelines because they've got really good guidelines and examples there. I just pulled up a sample APA 7 paper from Purdue that we use. I was like,
Excuse me, hold on a second. I know APA is important. You mentioned we shouldn't have titles bolded.
and she said some other things that just didn't sound APA at all. I said,
We've been told to use the Purdue website for examples. Here's an example. It's got this going on and this going on and this going on.
and her response was,
Oh, well, they must have updated APA since I did things last. So, yeah, you can go ahead and follow whatever that is.
but I thought, you're taking points off for people doing APA wrong, and you don't even know what APA is supposed to be, and it just rubbed you the wrong way. I get that they're supposed to grade us partly on following APA, but to be honest, I feel like as long as you attempt it and don't make some like glaringly obvious error in your thing, like you leave off a title page or something, most of our professors at Elmhurst have just given us full points for APA. There's so many little things you could nitpick. If they see it in general at a glance looks like an APA paper and there's not some glaringly obvious thing, they're giving full points. And apparently she's nitpicking and she doesn't even know what APA style is. So that, I don't know. I'm spending a lot of time rambling about this one clinical supervisor, but it's not a perfect program. Sometimes Elmhurst is gonna hire someone that maybe isn't the best for the job because that's the only person they can find to hire. But to me, it was the best program out there for me. If I had to do it all over again, I would still sign up with Elmhurst program because I don't think there's a program that fits my needs better. I don't know. Some people are spending a lot of time complaining about this clinical supervisor, and I say this after I can see on the camera, I've spent about 15 minutes complaining. This will get edited shorter, I'm sure, but I just spent about 15 minutes complaining about her to you guys, and it feels good to vent. But at the end of the day, I just let it go. She does not keep me up at night. Even if I get a lower grade on the paper than I think I should, because she thinks that it's my fault that Blackboard made a formatting error, that's not going to keep me up at night, guys. You can't let that stuff. You can vent, you can get frustrated, but don't let it raise your blood pressure. I mean, it's just not worth it. And some people are getting really, really upset when the school makes mistakes, when the school has hiccups in their program, or the school has a clinical supervisor that really honestly just is subpar, talks just like we're little kids and just looks for our faults, and just a general attitude about the way she talks to us. She's the first clinical supervisor that hasn't just said, call me by my name. I don't know how it is in other schools, but in our program, all the other ones have just been like, call me Joy, call me Travis. And yeah, like, I'm a mentor, I'm here to help you, but, I'm going to give you as much respect.
Continue on
as you're
South
giving
Dirksen
me.
Parkway for 1 mile.
Kind of the whole Mrs. thing, that's like a thing of respect, but I don't know. It is what it is. I feel good getting off my chest and complaining about her to you some, but I mean, I'm going to be done with school in less than 80 days, and I don't think there's much she could do that would ruin my mood too bad. I might not like the way she teaches, but like I said, it doesn't make me in a bad mood all day. I'm still smiling. I know that even if she were to inappropriately nitpick me too much, which I feel like there's a chance she could do that. I feel like if someone got a bad preceptor, because, you know, not everyone gets the same level of encouragement of preceptors. I feel like that's a possibility, you know, that if someone had a bad preceptor, they could just put a little too much, I don't know if you're going to be a capable nurse, because they don't see us in person and they're relying on the preceptor and all that. I think that the program would come in and vouch for us. I think they would say, you know, this person's had no problem with any of their other clinicals and they're doing great on their papers. And I think that the professors would question
in a quarter mile, use the left 2 lanes to turn left onto Illinois 97 North, East Clear Lake Avenue.
She can't run my program. I don't think she has that power. Overall, I think it's a great program, and my clinical placements have been, I don't love this current one, but overall have been like way better than what I would get in a normal program, more tailored to me. It's the most flexible program I could get, but it doesn't mean it's perfect, and it might not even be the best program for you, because it just depends on your needs and where you live. Because if you live in Chicago, I'm not sure they can find placements near you, and some people are driving like 2 hours. You don't want to be in that position. Like, that would not be the best program for you if you're driving 2 hours to clinicals. So I rambled. Chris is probably annoyed at how much he has to edit this apart, but that's my thoughts on Elmhurst. It's not perfect. They're gonna make mistakes too. They do make mistakes. Doesn't ruin my day.